Have you ever heard about nonverbal language? Where there's something that gathers the ways of manifesting a nonverbal language, and it's called art therapy. The British Association of Art Therapists defines art therapy as a form of psychotherapy that uses the artistic medium as its main form. For its practice, no previous experience or training in art is needed, and what is sought is to train the patient to make changes and grow in a personal level by using artistic material in a protective and facilitating environment. On the other hand, the American Art Therapy Association characterizes art therapy as an approach to mental health that utilizes the process of creating art to improve mental, physical, and emotional wellness. The techniques used in art therapy can include drawing, painting, coloring, sculpting, or collage. As people create art, they may analyze what they have made and how it makes them feel. Through exploring their art, they can look for themes, conflicts, problems, mistakes that may be affecting their thoughts, emotions, and behaviors. Some research suggests that just the presence of art play a part in boosting mental health. There is a study carried out in 2017 that found that art display in hospital setting contributed to an environment where patients felt safe. It also played an important role in maintaining the identity outside of the hospital and that socialization. I'm sure that you've been able to see at least one image of a cancer hospital where most of the patients are children, where you might have seen that there is always an environment full of vivid colors, where there are toys, instruments, and there's always good music. But what do they get from that? That's a question you might be asking right now. Well, doctors and psychologists get two things. In first place, they keep their children's mind and hands busy doing something that makes them feel uh, different to what they are feeling every day, which is cancer, right? Well, when children paint, they listen to music, play instruments, play with toys, all those things, any other way make them feel good, happy, that they make them feel joy, and those are positive feelings, yeah, right? Different to the feeling that cancer makes you feel, which is really horrible for them. And at the same time, this is where that non-language, non-verbal language comes in. Psychologists can deduct what they are feeling or thinking, right? For example, the graphologist deduct that the patient is feeling angry when he or she is drawing and he is pushing the paper and pushing the pencil in the paper really strongly, right? For example, if a child is drawing a house and he is sort of he's sort of pushing the pencil like he wanted to rip the paper out, it might mean that he hates his or her family, he doesn't like a relative, right? And there's another code in that language which is the colors, right? And it can be seen in a movie called Inside Out by Pixar. Joy was yellow, anger was red, sadness was purple, fear was purple as well. And then you see how feelings and emotions are connected with colors, right? For example, the happiness is always represented by yellow, sadness by purple. It's like positive feelings, vivid colors, negative feelings, dark colors. That's sort of what that language means, right? Some situations in which art therapy might be utilized include people suffering or having stress, children having behavioral or social problems either at school or at home, and mostly people who are suffering from a traumatic experience. For example, a relative of yours died 2 months ago, then you can sort of reduce that the pain by art therapy. So, in conclusion, most of what art therapy aims to get on people is to reduce the effects of mental problems, mostly stress, and escape the ordinary.